Created in part for those facing a cancer diagnosis, fertility preservation is a relatively new treatment option for those seeking to extend the possibility of starting a family until well into their 30s and beyond. With more on fertility preservation, here is Dr. Millie Behera.
Fertility preservation is another new and exciting area of reproductive medicine. It essentially allows us to give women the opportunity to preserve their eggs or embryos for future use and future chances of reproduction and conception and lead to a healthy pregnancy. It began with the use of freezing of eggs and embryos in the setting of cancer or impending chemotherapy for young women or even for men, which allowed us to perfect the technique and allow us to advance that area of therapy. Now that we are able to do that well and have effective, healthy outcomes from frozen eggs and frozen embryos, it's now something that's available for many women who are in a situation that they desire fertility. Very often as to when is the right time to freeze my eggs or what's the right type of setting to freeze eggs. So for a lot of women where the timing wasn't right or their careers are their priority for several years, a lot of times those women are looking for options like this where they can preserve their fertility and allow them to have some confidence, some backup, some insurance for the future when they desire to have their families. So by freezing their eggs or embryos, they allow themselves that opportunity in the future. We have always been able to freeze embryos very well with good freezing and thaw rates for future pregnancy and lead to healthy pregnancies. However, the new and exciting area of fertility medicine is the freezing and thawing of eggs. We now use a technique called vitrification, which allows us to flash freeze an egg and allow it to retain its health to be used in the future. And this now allows women that opportunity to not just have an option in the setting of an urgent situation such as cancer or chemotherapy, but it's now available for all women who desire that opportunity to save their fertility for future. Fertility preservation therapy includes the initial steps of an IVF or in vitro fertilization treatment protocol. So that means undergoing medication for the first 10 to 12 days of a cycle, which will grow multiple follicles where the eggs are growing within the ovary. And once those eggs have been retrieved, they may be frozen at that point to be used later on and fertilized at that point, and then grown into an embryo and placed back in the uterus to lead to pregnancy. Or they may be fertilized now and preserved as embryos to be used in future pregnancy cycle. So a woman has an option of either freezing her eggs or the embryos themselves. It's very exciting to be practicing reproductive medicine in these times when these therapies are becoming more and more successful and allowing women the opportunities to have fertility preservation and successful therapies more than ever before.
We hope you enjoyed today's show and look forward to seeing you next week with more news and information about the doctors caring for you, caring for Arizona. Until next time, I'm Angela Scott.